This is Beshama LP, also known as Pencil and Eraser Channel. My name is Olafuse Alex Kolawole. Hepatitis is an inflammation of the liver caused by infectious and non-infectious agents. Hepatitis, HEPA. When we say HEPA, we talk about liver. Itis means inflammation. Now, when you have inflammation of the liver, then you have hepatitis. Now, when we talk of infectious agent, we talk about virus, we talk about bacteria, we talk about parasites and some other agents. Then when we talk about non-infectious hepatitis, we talk about hepatitis that as a result of non-infectious agents. And one of it is heavy use of alcohol. That's why you can have alcoholic hepatitis. We have toxins. We have wrong use of medicine or drugs, as we want to call it. We have autoimmune disease. There are times that the body see your liver as a foreign body, and also they try to develop an antibodies against it. So it is called autoimmune disease. Hepatitis per se is not an hereditary infection, but can be passed from mother to child during labor or at birth. Are there types of hepatitis? Yes, we have hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. Now, how do we recognize them, or what are the causative agents of each of these hepatitis? Hepatitis A is caused by hepatitis A virus. Simple. Hepatitis A is caused by hepatitis A virus. It is acute, most of the time not chronic. Acute means it may start suddenly. And also, hepatitis A may be gotten from contaminated food and water, especially where the sanitation is very low. Hepatitis generally is not as a result of blood alone. We have known now that you can also get hepatitis from contaminated food and water. You can also get it from vegetables that are not properly cooked. Hepatitis B is an ongoing infection and it's always chronic. Okay, a mother may transmit it to the baby during delivery, so that is why every woman is screened for hepatitis during pregnancy. It is very, very important. It is very important for pregnant women to attend a good antenatal clinic where they will be, where all these tests will be conducted on them. The Center for Disease Control in America estimates that about 257 million people live with hepatitis B globally. You think it shouldn't cause for concern? It should. Over 257 million people live with hepatitis B virus globally. In another statistics, we know about 400 million people are living with hepatitis globally, especially the infectious and the most dangerous, strain of it, hepatitis B and hepatitis C. About 400 million people worldwide. So I don't know why hepatitis has not become a public health concern, just like HIV and malaria. Last year, during World Hepatitis Day, the theme was elimination of hepatitis can't wait. And that is why we are bringing this video to us, to sensitize us, to create the awareness. Directly from Dr. Enahire Osage, the Minister of Health in Nigeria. He said 18.2 million Nigerians are affected with viral hepatitis. That is huge. It's not a thing to be joked with. And the awareness is too low. Not many people are talking about hepatitis. People talk about malaria during World Malaria Day. You see how people roll out drums and everything. On the 28th of July, our world will be celebrating World Hepatitis Day. Are there any program in place? How many people know about hepatitis? How dangerous hepatitis is? We know about HIV, but what of hepatitis? So it is very important for us from this video to please begin to sensitize our people. And now let me tell you this: if you have not subscribed to this channel, please do subscribe to the channel, okay? And remember to hit the bell notification to know when I bring my videos, and do well also to share this video. Like I said earlier, I said the reason for increased incident rate of hepatitis is because of the low awareness. And that was the same position. That was the same position, Dr. Enahire, the Minister of Health, agreed with last year. In the last edition of Pharma News, if you go to July edition of Pharma News, page 19, volume 44, number 7, page 19. You want people to begin to talk about it. Let there be an awareness, and that this has become should be a public health concern. According to WHO, that's what the organization say, undiagnosed and untreated hepatitis kills. It kills faster than whatever you can think about. They posited that it has killed over 124,000 Africans annually. Hepatitis infection, whatever it is called, whether bacteria, whether from food, whether from viral origin, kill over 124,000 Africans annually. It is huge. And that about 4.5 million children are affected with hepatitis B, hepatitis B infection in Africa. Hepatitis B can be gotten from mother to child, can be transmitted from mother to child during delivery. Not only that, it can be gotten through sexual intercourse, from infected semen, infected blood, and fluid, generally body fluid. Every fluid, every secretion from human body as infectious until otherwise proven. We also know that blood transfusion can also cause this being. Nowadays, with the increase in the level of awareness and everything, every blood is screened for hepatitis B, especially. So the level, the risk from getting it from blood transfusion maybe have reduced. Same cannot be said of sexual intercourse, of tattooing of the body, or sharp blade, sharing of sharp blade, use of contaminated needle and syringe. You're going to take an injection. Please make sure a needle and syringe is open for you each time you want to take injection. Okay, let's move on. Let's go to hepatitis C. C is caused by hepatitis C virus. It's very common. It's one of the most common of blood infection caused by virus. So we have viral hepatitis C. So it's caused by hepatitis C virus. It can also be gotten from semen, blood, human secretion, and so on and so forth. So you got to protect yourself. Hepatitis C virus may be long lasting and may cause liver damage. Now, hepatitis D. Hepatitis D is caused by hepatitis D virus. Okay, and it always work in tandem, in conjunction with hepatitis B. So people that have hepatitis B are always prone to hepatitis D. Someone has said there is no hepatitis D without hepatitis B. Okay, so we should know that. So it's caused by hepatitis D virus. Now, hepatitis E is more of it's just like hepatitis A. Okay, it is gotten from contaminated food and water. The causes of hepatitis. Okay, we have established that we have contaminated food and water. That is important to note. Contaminated food and water, especially in hepatitis A and hepatitis C. We talk about contaminated blood. That is blood that is not properly screened. When you have sexual intercourse with an infected person, so you also should suspect hepatitis E. Not only HIV, contaminated food. Talk about contaminated razor or blade. We talk about infected syringe or needle, or syringe and needle stick injury, especially health workers. Please be careful. We talk about mother to child transmission. We talk about infected fluid from human body. But also we have talked about eating of raw vegetables. that is contaminated with hepatitis virus, especially hepatitis A and E. It's common symptoms of hepatitis: dark urine, stomach pain, yellow discoloration of the skin or of the white of the eye, that is conjunctiva. So you may have yellowish conjunctiva or yellowish skin. So once you start noticing these symptoms, please consult your doctor. Pale or clay color stool. Your stool is pale. It's not brownish. You have loss of appetite. You have fatigue. You are easily fatigued. There is loss of appetite. Aching joints, or your joints are aching you. Don't just think it's only malaria. So it may be as a result of hepatitis. In children, you may have an enlargement of the liver. The liver is enlarged. We have malaria also in children. Can cause that. Then you see all these symptoms. What are you to do? The best thing to do is to consult your doctor. The video is just to guide us, to direct us, to know the sign and symptom, to know the risk involved. How is hepatitis diagnosed? History and physical examination. Yes, you go to your doctor will ask you series of questions. Okay, so do well to give correct answer. Okay, and we will do some physical examination, look at your liver, look at your check your conjunctiva, check your skin, compare it with the standard, and so on and so forth. Not only that, there are blood tests to do. Can do liver function test, and if there is an increase in some enzymes in your blood, it may mean that your liver is stressed or is diseased or damaged. Okay, so your doctor will know how to read the test, or your microbiologist or laboratory personnel, they will be able to guide you. Okay, not only that, you can do liver biopsy. Liver biopsy is done by a doctor. Okay, there's a way they do it, so I will leave that to them. Not only that, you can do general abdominal scan. Your liver is examined. We have so many issues that may be wrong with liver. May have alcoholic liver, problem. You may have liver cirrhosis. You may have liver cancer or enlargement of the liver. Let's talk about the preventive measure. How do we, prevent ourselves from contracting hepatitis? One is by testing, screening. Go for hepatitis screening so that you know whether you have contracted the infection. Some people may have this infection for years, and the thing is, the earlier the infection, the more dangerous it is. Especially the one passed from mother to child, the more dangerous it is. So it is better to go for screening. Go and do the test. Once you have to undergo treatment immediately. Go and see your doctor. They know what to do. Another way of preventing it is by immunization of our baby under 5. A mother also, we need to protect the unborn child. They take your blood, check for hepatitis. Once it is discovered that you have hepatitis, there is a special injection called HBIG that must be given to the child within 24 hours of delivery. Okay, and it's advised that you don't breastfeed, so that you don't some people have said there is minimal chance of transmitting it through breast milk. Okay, but it is better, it is better to prevent. Prevention is better and cheaper than cure. Another way you can prevent yourself is the status of your spouse. You don't know who is incubating hepatitis. You don't know who is infected and carrier of hepatitis. So before you begin to go deep, begin to dig it. Now it is better you know the status of your wife or your spouse or your girlfriend. Another way to prevent it is by cleaning your environment. Maintain good environmental hygiene, and you must cook your vegetables, meat very well. That is very important. And if by chance you are infected with hepatitis, go to hospital, go to your doctor, let them treat you very well, especially if you are a food vendor. Okay, there is a chance of infecting other people. If you have not subscribed to my channel, please do. And talk to your friends about it. Share the video, like them. If you have any comment, please use the comment section. And if perhaps you have any video in mind you want us to talk about, okay, please let me know in the comment section. Okay, and do well to turn on the bell notification so that you know when I drop my next video. Okay, importantly, please share this video. Let it go wild, let it go viral, let people see it. The awareness about hepatitis is too low. It's too low in Nigeria, and people are getting infected every day. So I will see you very soon, and don't forget, July 28th is World Hepatitis Day. So let's loud it, let's make noise about it, let's create awareness, let our world know about hepatitis. Thank you very much. My name once again is Olafusi Alex Kolawole, and this is Beth Sharma Healthpreneur, also known as Pencil and Eraser Channel. Your health is important. Please guard it jealously. See you soon.